situation, the repatriation of Filipinos from China, and an update from the WHO will also be part of the agenda. No? But since they're there, I've been asked by the Secretary to give you the updates for today. And I'd just like to start by saying that the WHO declared the novel coronavirus acute respiratory disease. This is now the official name, no, of the illness. It's 29nCoV-ARD. The novel coronavirus, 2019 novel coronavirus acute respiratory disease, or 2019 nCoV-ARD. The WHO has declared the novel coronavirus acute respiratory disease health event as a public health emergency of international concern after an emergency committee meeting convened on January 30, 2020 in Geneva, Switzerland. To date, the WHO Emergency Committee on the Novel Coronavirus, under the international health regulations, does not recommend the imposition of any travel or trade restriction. However, the WHO always respects the sovereign power of member states to impose measures aimed at protecting the health of its constituents. The Philippine government, upon the recommendation of the Department of Health, has issued a temporary travel ban covering all travelers from Hubei province of China. The DOH will also be recommending the expansion of the travel ban coverage to more Chinese provinces as new information on the increasing number of cases per region arises. In the Philippines, the DOH would like to report that there are no additional patients under investigation as of today. So yung PUIs natin, as of today, remains to be a total of 29. 23 of the PUIs are currently admitted and isolated, including, of course, the positive case. 5 have been discharged but are still under strict monitoring, and we have one mortality, as you all know. The DOH is assuring the public that the first confirmed case is isolated and being properly treated, and that contact tracing is already being conducted in coordination with the Bureau of Quarantine, the Epidemiology Bureau, and other government agencies. Stricter infection control measures are also being implemented in our hospitals with PUIs both for patients and health workers. With this declaration comes the need to be more vigilant, and we continue to urge everyone to practice precautionary measures, such as observing proper hygiene, following proper cough etiquette, avoiding crowding places, eating nutritious food, and hydrating oneself. For our health workers, we strongly advise you to wear protective personal equipment, such as our disposable face masks, gowns, and gloves, when in contact with the patient, especially their blood, body fluids, or secretions, in keeping with the prevailing hospital protocols. We also remind our health staff to ensure proper disposal of hospital waste. And we urge everybody to wash hospital laundry thoroughly to boost their immunity, and of course taking care of themselves and monitoring themselves for signs and symptoms. Because the safety of our health workers is paramount, to the Department of Health. And yes, Dr. Abilino, at this point I'd like to give the floor to Dr. Rabi.
Thank you very much. So there was a lot of anticipation on the outcome of the Emergency Committee for International Health Regulations in regards to the outbreak of the 2019 novel coronavirus disease. So the committee met yesterday, and the committee was presented with updated information to better understand the transmission of the disease, the number of cases, the number of deaths, and what we know about how the disease is transmitted. Taking this information into careful consideration, and recognizing that still the majority of cases are within the People's Republic of China, but acknowledging that cases have already been confirmed in approximately 18 countries, and there is clear person-to-person transmission in 4 countries, the United States, Germany, Japan, and Vietnam. The committee concluded that there was adequate evidence to classify this disease outbreak as a public health emergency of international concern. I want to reiterate that the essence of this classification is to help member states strengthen their preparedness and response capacities to deal with preventing and controlling this outbreak. This classification is largely about controlling the spread of the virus and the disease it causes. The committee acknowledged the good work done in Wuhan and in other Chinese provinces to arrest the spread of the disease and indeed to contain the disease from spreading outside of China. However, the committee believed that there was room for a more coordinated international response to this situation. The committee also emphasized that they believe it is still possible to interrupt the spread of the virus, provided that countries can put in place strong measures to detect the disease early, isolate and treat cases, trace contacts, and promote social distancing commensurate with the risk of disease. We are working with the Department of Health and the Philippine government. As Dr. Domingo just mentioned, I will be attending the high-level meeting of the intersectoral agencies to see how better we can support the DOH and the government of Philippines in its efforts, recognizing that you already have one confirmed case and several persons under investigation. WHO remains committed to help preventing the spread of this virus and to mitigate its impact on the Philippines and other member states, and is mobilizing all its resources across country, regional, and headquarters levels to facilitate that process. We are also working together with the government of China through the sending of teams of international experts, as agreed with the Chinese government, to facilitate a better understanding of the disease, to understand better the measures that are being implemented in China and how they can be translated into other countries who have significantly different capacities. So I want to reiterate again that here in the Western Pacific region and globally, WHO is committed to help all member states, irrespective of their capacities, to prevent and control the spread of this virus and the disease it causes. Thank you.
breaking news lang. No? I mean, kaya tumatakbo si director natin ng Epidemiology Bureau. Let me just correct. As of 12 noon today, we had 2 additional persons under investigation reported in the last 24 hours, which brings the total to 31. We have now 31 persons under investigation, including one of them which turned out to be the positive and verified case.
Good afternoon. So I think we'll give questions muna to WHO because Dr. Murabi will be attending the EFF. So if we could limit it 1 question per person and at least 4 questions.
Hello, Dr. Rabi. Good afternoon. Just like to clarify, because last January 28, you've mentioned that the 2019 nCoV ARD is not transmitted during incubation period and when a person is asymptomatic. So the latest study of WHO, does it also show the same way, just what you have stated last January 28?
So thank you for the question. I think it's an important question. The Chinese authorities have presented evidence that there is a likelihood that this novel coronavirus could be transmitted before the emergence of symptoms. But I want to emphasize a very important fact that in this case, as in the case of the MERS-CoV infection, most of the transmission, in fact more than 95% of the transmission happens from symptomatic patients. It's a very negligible transmission that happens during the incubation phase before people who are infected become symptomatic. We need to evaluate this risk appropriately and communicate it correctly. If we do not do that, we create unnecessary concern and panic among people. The evidence now shows that the disease is overwhelmingly transmitted by symptomatic people. So yes, there is a place, but the actual transmission that is being reported is negligible. I want to re-emphasize that this is what we know at this point of time. This may change as more evidence emerges, but this is similar to what we had during the MERS-CoV outbreak. So that's what we are saying, that it's more important that people practice the measures that we have already advocated to prevent the spread of this infection and indeed other coronavirus infections, including hand hygiene, cough etiquette, and cooking foods, because those will be more important, especially social distancing of people who have signs and symptoms of an infection. We want to emphasize that strategically focusing on preventing the disease transmission from those individuals is far more important than focusing on trying to prevent the negligible transmission that may happen from asymptomatic people.
Dr. Rabi, I'm Melo Apolla from Facebook. What protocol has the WHO recommended that should be observed should a patient die because of the virus? Does it have to be cremated? Does he have to be cremated? If it's a foreigner who dies in the Philippines, how do we dispose with respect to the body of the fatality?
So the processes are contained in our technical guidances that have been shared with member states and their departments of health. We are hoping that we can minimize that, but we have shared already guidance on how that needs to be handled. I don't want to go into the technical details here, but the guidance is already available for member states.
still on the transmission, is there any study of shows how long does the virus live outside of the host? If and when the symptomatic person sneezes or something like that.
I'm sorry, we don't have clear, good evidence on that.
Sir, overnight, the number of cases globally has risen to about 9,000. It's already higher than the number that we had for SARS. What can we say now in terms of the disease being? Is it more contagious now than SARS? And what can we say about the transmission? Is it easily transmitted compared to SARS?
So our position is that you should not just compare numbers, because in the case of SARS, we had not identified the pathogen and we didn't have a test for more than a month. So we didn't know actually how fast it was spreading. We didn't have the numbers to confirm. But in this case, because the Chinese authorities were able to identify this virus and rapidly share the genome and testing protocols, we have been able to test a lot of sick people and people with mild symptoms. And that has provided the ability for us to confirm a large number of infections. So if we look at, this is also partly because of the investments that WHO has encouraged governments to make in preparedness and readiness. And we are seeing the dividends of that preparedness by these actions that China was able to implement and the knowledge it has shared with the global community through WHO. So we shouldn't just compare the numbers of confirmed SARS cases to the numbers of nCoV because that would seem out of context. You have to take into consideration what has happened on the ground over the period of the 17 years in between.
Any difference, sir, in terms of the pathogen between SARS and nCoV? Any difference in terms of symptoms maybe or characteristics of the virus?
So most coronavirus infections cause an acute respiratory infection. And in the case of nCoV, this is no different. Right now, we are looking at approximately 25% of nCoV patients having severe symptoms. I want to reiterate again that many of the patients who develop severe symptoms have underlying pre-existing health conditions. We are still seeing that in many of the cases that progress to severe disease and also in many of the fatalities. So we need to look at both the possibility of severe disease developing and deaths occurring in the context of this information that is currently available with us.
We will be having two last questions from Janelle and Sir
So lawmakers yesterday called for a travel ban on mainland China. Why is it that the WHO does not advise such travel restrictions? And can you help us with that? Because a lot of people just want this travel ban and they think that's all they want right now for travel.
So we in WHO, we look very carefully at the evidence and how practically feasible imposing a travel ban is, what social and economic implications it will have, and how successful it would be. And based on some facts that we already discussed, WHO does not favor at this point of time imposition of a travel ban. We are not recommending travel restrictions. Even the committee recommendations last evening stated that we don't recommend travel restrictions. But it suffices to state that our recommendations are not binding on member states, and based on risk assessments, they are free to make whatever decision they want. However, if member states, even after the declaration of a public health emergency of international concern, decide to impose travel restrictions, they are obligated under the international health regulations to inform WHO of what those restrictions are and the justifications why such restrictions were placed. Because WHO will then be obligated to share that with other member states so that everybody is aware of restrictions placed, and WHO may in fact even discuss with the concerned member states on the appropriateness and the effectiveness of those measures.
Last question from us. Dr. Rabi, we're now entering the second month since the first cases broke out. We just have the development or noted development or finding out the actual source of the virus, or what stage are we on that?
So the source of the virus, still the suspicion remains that it originated from some meat. It has yet not been proven what the source of that virus was. We are urging member states to research that question because it's important for us to understand from what source this virus emerged. But what is now important is to realize that the evidence points to the fact that the current transmission is not linked to the virus spreading from that meat. Already the virus is spreading from human to human. So yes, it played a role as an initial source, but now it's clear that the virus has acquired the capacity to be transmitted from human to human. But in the wider picture of controlling the disease, it's important to gain that knowledge on what was the source and whether we need to do something about that. In that regards, what WHO advocates is to ensure that all meats are properly cooked so that the virus is completely destroyed if it's present in the meat. So we are advocating that people refrain from eating raw meat or undercooked meat. And also in the handling and processing of raw meats, whether it's at home by having separate cutting boards, whether it's in wet markets or meat shops.
I thank you, Dr. Rad. So the next is Dr. Rad first, because we will be going to that yet. Now we're having questions from the Department of Health. We'll be having 10 to 15 minutes on this discussion. So first.
For you, Secretary and Director Abelino, where are we now in the contact tracing? Kasi, sir, yung public, they want to know the details, flight details, the establishments and the source visited by the positive patient. I think that can also help you in the contact tracing para mas madali. Because if people are worried, they're going to consult you, they're going to call the DOH that I was on that flight, what do I do?
Well, for the Bureau of Quarantine, no, for the flight details, we have already are in contact with the airlines, and the airlines have already given us the manifestos, and we are contacting yung mga kasabay sa plane, no, especially ngayong 4x4 rule natin. That's going on now, and everybody who's been shared a flight with the patient will be notified.
So yung flight details, name ng resorts, name ng establishments, are you at liberty to disclose?
Well, the details kasi like the resorts, we are going to our staff from the epidemiology and surveillance units are going to the resorts directly. So pupuntahan naman sila diretso. At this time, we are keeping naman some privacy for the resorts and giving them time, of course, to cooperate with us and help us in trace, especially workers nila who possibly came in contact with the patient.
Sir, I'm sure you mentioned this yesterday, yung flight yung airline lang.
Yeah. Yung sa pasyente natin who came in from Hong Kong to Cebu on January 21 came in via Cebu Pacific. And then from Cebu to Dumaguete on the 22nd, Cebgo, yung flight niya. And then yung flight from Dumaguete to Manila was through Philippine Airlines. And the airlines have been very, very helpful and cooperative with us.
Sir, given the declaration of global emergency, is there an With the recent development that we have at the moment with regards to especially that we have a case of confirmed case of nCoV, we have changed number one the table wherein we are using a table in assessing travelers who are sick. So that one have changed. Now we are also discussing on who will go on a facility-based quarantine against a home-based quarantine. So that's another things that we are looking at now, given that this is the development.
And I mean, if you realize the other day, the Interagency Task Force, the recommendation was to, ano nga natin, recommend restriction of travel from Hubei to the Philippines, but now the position of government is a ban. It's a ban of travel from Hubei province to the Philippines. Of course, we're probably going to add more provinces as we get more information on the number of cases per province. Meron naman tayo for infectious for all infectious cases, we do have standard protocols on how to dispose of itong mga masks, gowns, and any hospital equipment that has been used for patients. It's not different, for example, from patients with HIV, patients with nCoV, with SARS or MERS. So it's not something that we have to invent completely for this new disease. Ang all infectious diseases natin, yung paggamit ng mask, pagsuot ng protective equipment, and the disposal is a standard protocol already for our hospitals. No, well, the Chinese, I believe the Chinese embassy has already been informed. Pero syempre, hinihintay pa natin yung results. And we believe, because the RITM is running, na-establish na yung test ng RITM, no? So, alam na yung mga, since we have the new reagents and the primers, they were setting it up the last, last couple of days. And now they have established the test and they are running our samples already. So, we hope to have final results of this within the weekend.
Yung sa patients na nag-positive, para siyang turista siya, was she with the group and kamusta yung mga kasama niya when she was going around?
She was a tourist and she was traveling with a companion. No? Yung companion is also admitted as a person under investigation, also in the same facility, and we are awaiting results for that patient.
Can you clarify the travel ban to Hubei province? Is it limited to Chinese or does it involve all the persons who have a history of travel to Hubei? And you mentioned in your opening statement that you will expand the scope of the ban based on new information. So what kind of information are you looking at and what would drive the expansion? Because the Chinese government has already reported that cases have been confirmed in practically all the provinces of China.
Well, yung for the travel ban, that's one of the topics of the meeting of the Interagency Task Force today, no? Because this was a directive from the President after the recommendation of the Department of Health. So yung actual details of it will probably be out by this afternoon or tomorrow. But basically, people traveling out of Hubei, Wuhan, and who have had history of travel or came from there before traveling out of China. No? So ito yung, but the details we have to wait for that. No? It's going to be an issuance that will have the details. Now yung list ng provinces, we're still talking, after this we're meeting again with Dr. Rabi because it's really, what we want is to see the magnitude of cases in one province. Kasi even though all provinces of China have cases now, meron naman 1 or 2 or 3. But we're thinking of setting it, for example, at 100 cases. Once you have 100 cases in that province, we'll include it. But the actual criteria, we need some guidance from the WHO. I think naman for any illness and for any viral illness, hydration, proper hydration has always been advocated by all doctors, and this is universally accepted. And I believe it stems from that. It's really proper hydration.
The new two PUIs are from China. The nationality is Chinese, and the other one is American. One Chinese and one American. We're still in the process of getting the information, but we will be providing you once we have more information. Sorry? Hindi. They are from two different regions. They are now in two different regions. Two different places. It's usually the fever and the cough. Okay, so we would like to clarify these two terms. So we have nCoV health-related events and the person and a patient under investigation. The first one is any traveler or person with history of travel in China in the last 14 days manifesting fever, cough, and cold. While the person under investigation is a person who have traveled to Hubei, who manifested fever or cough or colds in the last 14 days. So yung isa person, a patient under investigation ay mas focus doon sa ground zero.
Next was your take po dun sa mga panipala na huwag na lang pong banggitin yung buong ospital kung saan naroon yung mga PUI.
Well, in this case, we disclosed the hospital because every other hospital in Metro Manila was panicking. And I think to put that a lot of people to rest and just be assured that nothing is being hidden from them, we thought it was better to disclose. And you know, San Lazaro Hospital is well equipped. They've been handling infectious cases for the 400 years, and everybody, of course, in the hospital knows that the patient is in there. So we found, I don't think there's any harm in disclosing. In fact, it puts to rest a lot of speculations. Yes, no, that's a first step. Those are the two things. First of all, we did send one more last sample 2 days ago. Ito yung doon sa companion nga no nung pasyente natin. But after that, all tests will be done here in the Philippines. And it will save a lot of time because yung ano lang, yung palang handling and then coordinating and transferring human samples that might be infected is so tedious. It takes 3 to 4 days to get from here to Australia. So, and the actual testing will take 24 to 48 hours. So yung 3 to 4 days yun yung mababawas. Plus, we can do it on all samples that we need to do. Kasi with the WHO protocol for us sending samples to the reference lab in Australia, ang dami nating ginagawa pa ng mga preliminary tests, may screening pa, tapos pipili lang tayo ng pwede nating ipidala. So ngayon, mas madali na. Pag PUI and we think we need to test for that 2019 nCoV, we will be able to do it and do it quickly in the country.
Sir, going back to hydration, may issue kasi na you need to gargle with salt water with salt.
Well, I think this is a home remedy naman that has been followed for many, many generations, and I don't think there's going to be any harm in doing it. Saline gargle has always been advocated to improve yung mostly yung symptoms ng sore throat.
But it doesn't necessarily cure you of nCoV or it doesn't necessarily...
Well, I don't think there's any evidence that will show that it will kill a virus.
Can we just get an update on the situation at San Lazaro Hospital? We understand that the bar is one of the person
currently in San Lazaro, we have 3 PUIs. The 2 are the one that has been reported yesterday, and then there was one that was completed yesterday.
Can you say that again, Sir Almoy?
There are 3 PUIs admitted currently in San Lazaro. The 2 were the couple where we had the first nCoV case and her partner, and a new case was admitted yesterday.
Sir, just a clarification regarding the interagency task force. Hindi na talaga kasama yung NDRRMC. And now that you have the first case of nCoV, what is the task force going to do moving forward? Ano yung magiging assignment ng members ng task force?
Well, actually, particularly, I think the agenda today is the repatriation, no? Because the DFA has already contacted our missions in China, and they've made a count, pending, of course, finalization of the number of Filipinos who want to come in and be brought home. I believe they will set a target day today on when they will fly them in. And of course, at the part of the Department of Health, our job is to make sure that when they come in, that we have proper quarantine facilities for them, that we're able to transport them securely and without, of course, any risk to themselves and to the public, and make sure that they are comfortable while they are in quarantine. So ito yung big, this is the big gist, I think, of what will be discussed today at the IATF, plus, of course, the travel ban, the conditions of the travel ban. We are already coordinating with DTI, no, particularly dun sa price freeze natin for the face masks and mga kagamitan, no, na kinakailangan, tsaka nagkakaroon ng konting scarcity ngayon. Of course, we're also coordinating with the suppliers to make sure that they bring in, no, as much supplies here available. But still, no, we ask the public to be very, very judicious in the use of these materials. For example, the N95 mask, we want to reserve this for health workers who are actually handling cases, no? Yung either PUIs natin or confirmed positive cases, kasi sila talaga yung nangangailangan nito. At we ask everybody na wag na sana pong makiagaw doon sa supplies dyan, dahil ang nangangailangan talaga yung mga nag-aalaga ng pong ating mga pasyenteng may sakit. The surgical masks can be used by the public, no, in certain occasions. Ito ang sabi natin, not everybody needs to wear a mask every time. Unless, for example, you feel that you are high risk for illness, then that's useful for you. If you are in an area that's very congested, maraming tao, especially if there are sick people in the area, then that would be useful. It is also useful if you're the one who has an illness, no, so that you don't spread it to other people. But we'd like to remind everybody that using a face mask is only effective if you couple it with other hygienic practices like proper hand washing regularly. Kahit nakamask ka, kung hindi ka naguhugas ng kamay, hindi nababawasan yung possibility na mahahawa tayo ng sakit. No? So you have to use all of this in tandem and only when necessary.
At the moment, nakikipag-coordinate tayo sa mga private hospitals through advisories ng Department of Health. Pero kung ang isang hospital ay may kapasidad para matugunan yung pangangailangan, mas maigi pa kung hindi na ilipat yung pasyente. Ang importante lang ay makuhanan sila ng specimen para maidala sa RITM. Importante po yung infection control. Kung papalipat-lipatin natin yung pasyente, mas mataas yung posibilidad na maaari makahawa pa sa iba't na.
To this effect, we sent out a memorandum the other day, no, to remind all hospitals, whether government or private, that if you're a level 2 or level 3 hospital, ito yung medyo malalaking hospitals, no? Hindi naman yung mga level 1 or infirmaries. But if you're a level 2 and level 3 licensed hospital, it means that you have the capacity for isolation and treatment of infectious diseases as a licensing requirement. Kaya kung may lisensya kayo, may capability kayo, they are being reminded that they cannot turn away patients because of suspected nCoV, that they have to treat them and manage them within the facility. Wala naman tayong order na gano'n. The CHDs, our regional offices at the Department of Health, is helping augment the supplies of mga personal protective equipment to the DOH hospitals and LGU hospitals, but not to the public. In this, yung mga tela na mask useful siya for dust, but not for infection. For infection, the surgical masks. Wala, surgical mask.
Dr. Chino, can you just illustrate how difficult is contact by the department? Gano'n siya kahirap?
Kailangan namin magkaroon ng tamang kwento tungkol sa kung saan pumunta yung isang tao na may sakit at nagkakasakit. So the important dito yung history taking. So importante rin yung honesty ng tao na ikwento kung paano siya nagkasakit. At from there, the information that we gather, then sinususugan namin pabalik yung mga lugar at mga taong kanilang nakaugnayan during the course na hindi pa sila nagkakasakit. For this particular purpose, yung ating pasyente ngayon, inalam namin kung saan at ano yung mga eroplanong sinakyan nila, kung ano yung seat number kung saan sila nakaupo. Tapos we will be contacting the people around the seat para mabigyan sila ng advice. Maliban doon sa eroplano, tinitignan natin yung mga crew na nag-serve doon sa eroplano. So, bibigyan din po natin yun ng advice. At maliban doon yung sa eroplano, sa airport, at yung mga hotels na pinuntahan nila o mga restaurant na napuntahan para po ma-advise yung mga contacts na sinasabi natin. Ayaw natin na takutin yung mga contacts na magtago kasi hindi naman sila ikukulong. Importante na maintindihan ng mga contacts na dapat sila maobserbahan sa loob ng 14 days para kung ano man ang kanilang maramdaman ay agaran silang mabigyan ng tamang management.
For clarification, yung mga kasabay sa aeroplano, they don't have to necessarily quarantine.
Not necessarily, yung 4 seats at the back, 4 seats front, and then 4 seats on both sides, yung ikot na yon, yun ang ika-quarantine po.
Sir, in a dilemma, some passengers change seats without telling the flight crew. So yung manifest, baka hindi rin siya accurate.
Okay. So, importante na makita natin yung manifesto tapos sasabihin ng pasahero mismo kung siya ay lumipat na upuan o hindi. So, we have already the flight manifest. So, it's a matter of clarifying kung sila nga po ay nandoon sa area na yun.
So basically, lahat.
Yung nakapalibot sa kanya. Nagsimula pa lang ngayon yung tracing natin.
Okay, thank you very much.